Think back to the last time you had a genuinely good day. Not a perfect day. Not a day where everything went right. Just a day where you woke up and something inside you felt settled, steady, like the world was manageable and you had the energy to meet it. Now think about how often that feels true lately. If the answer is not as often as it used to be, if there is a low-grade flatness to some mornings, a tiredness that sleep does not fully fix, an irritability that did not used to be there, a fog that sits behind your eyes by early afternoon. Most people assume that is just what getting older feels like. I want to offer you a completely different explanation today. What if a significant portion of how you feel, your mood, your mental clarity, your emotional resilience, the baseline tone of your inner life, is being shaped not by your circumstances, not by your age, and not by anything happening in your brain, but by what is happening in your gut? And what if that gut environment has been quietly shifting for years in a direction that nobody warned you about, and that nobody has connected to the way you have been feeling? I'm Dr. Alan Miller, and after 18 years in senior health, I have seen what works and what silently harms. And one of the most consistent patterns I have observed across thousands of patients over 65 is this: the people who feel the best, mentally, emotionally, energetically, are almost always the people whose gut health is the most intact. And the people who are struggling most with mood, fog, and low energy are frequently the ones whose gut has been most disrupted. Not by disease, by the slow, invisible changes of aging that nobody prepared them for. Today I am going to show you exactly what those changes are, why they affect mood so directly, and what you can do, starting this week, to begin reversing them. By the end of this video, you will understand the gut-brain axis, the direct biological communication highway between your digestive system and your mood, in a way that most people never get explained to them. You will know why aging specifically disrupts this system, why the disruption gets worse after 65, and which common habits and medications are accelerating the damage without anyone flagging it. You will hear from 4 patients whose experiences I believe will sound familiar to many of you, and you will leave with a 5-step protocol that directly targets gut health for the specific purpose of supporting mood, clarity, and emotional steadiness in the second half of life. Stay with me through the middle section of this video, because what I explain about serotonin production is something that will permanently change the way you think about the relationship between what you eat and how you feel. Here is what the research has established, and what routine medical appointments almost never have time to explain. Your gut is not just a digestive organ, it is a neurological organ. The enteric nervous system, the network of neurons lining your gastrointestinal tract, contains more nerve cells than your spinal cord. It communicates continuously with your brain via the vagus nerve, a long, wandering nerve that runs from the brainstem all the way down to the abdomen and carries signals in both directions. This communication highway has a name in modern research: the gut-brain axis. And it is not a metaphor. It is a literal, anatomical, biochemical channel through which the state of your gut directly influences the state of your mind. Here is the number that most people find genuinely shocking. Approximately 90 to 95% of the body's serotonin, the neurotransmitter most closely associated with mood regulation, emotional stability, and a sense of well-being, is produced not in the brain, but in the gut. Specifically, by specialized cells in the gut lining that respond directly to the bacteria living in your intestine. Read that again. The chemical that your brain depends on to feel settled, optimistic, and emotionally resilient is manufactured primarily in your digestive system. And the bacteria in your gut are not passengers in that process. They are the factory workers. When the bacterial community in your gut is healthy, diverse, and well-fed, serotonin production is supported. When that community is disrupted, imbalanced, depleted, or inflamed, serotonin production falters. And after 65, that community is under more pressure than at any previous point in your life. The changes that happen to the gut microbiome, the community of trillions of bacteria, fungi, and microorganisms living in your intestine, after the age of 65, are well documented and largely underappreciated outside of research settings. First, microbial diversity declines. A healthy gut microbiome is characterized by richness, hundreds of different bacterial species, each playing a specific role in digestion, immune regulation, and neurotransmitter production. With age, that diversity narrows. The beneficial species, Lactobacillus, Bifidobacterium, Akkermansia, tend to decrease. Inflammatory species, which thrive in a less competitive environment, tend to increase. The balance tips away from the conditions that support serotonin production and toward the conditions that generate systemic, low-grade inflammation. Second, stomach acid production declines with age, a condition called hypochlorhydria. Stomach acid is not just for digestion. It is one of the body's primary defenses against pathogenic bacteria entering the lower gut. When acid production falls, the microbial landscape of the small intestine shifts in ways that further erode the beneficial bacterial colonies that support gut-brain signaling. Third, gut motility slows. The muscular contractions that move food through the intestine become less efficient with age. This slower transit time allows bacterial imbalances to deepen, increases fermentation of undigested food in ways that generate gas, bloating, and discomfort, and reduces the frequency and consistency of signals traveling upward along the vagus nerve to the brain. Fourth, and this is the one that most patients are genuinely not aware of, medications. Many of the most commonly prescribed drugs in adults over 65 have direct and documented effects on the gut microbiome. Proton pump inhibitors reduce acid and alter the microbial environment of the upper gut. Antibiotics, even a single course, can reduce microbial diversity for months or longer. Certain blood pressure medications, statins, and non-steroidal anti-inflammatory drugs all carry gut microbiome disruption as a side effect that is rarely mentioned at the time of prescribing. Individually, any one of these changes is manageable. Together, compounding over years, they erode the biological foundation that your mood depends on more than most people realize. Let me tell you about Agnes, 70 years old, a retired school teacher. Her daughter had encouraged her to come and see me because Agnes had become, in her daughter's words, a different person over the past 2 years. Not depressed, not clinically, not dramatically, just flat. Less interested in things she used to love, less engaged at family dinners, tired in a way that she described as coming from inside. Agnes had been on a proton pump inhibitor for reflux for 4 years. She had completed 2 courses of antibiotics in the 18 months prior, one for a urinary tract infection, one for a dental procedure. She had developed intermittent bloating that she had been told was normal for her age. Her mood panel was unremarkable. Thyroid, normal. Vitamin D, borderline. B12 in the low normal range. Nothing that would explain the change her daughter was describing. We approached her case through the gut-brain lens. We worked with her gastroenterologist to step down her PPI to the lowest effective dose and introduce an H2 blocker as a transitional alternative. We introduced a targeted probiotic protocol and a significant dietary shift toward fermented foods and prebiotic fiber. We corrected her B12, which is critically important in this context, and I will come back to that. In 3 months, Agnes's daughter sent me a note. She said her mother had started gardening again, that she was calling more, that she seemed, in her daughter's words, like herself again. Agnes told me she had assumed that flatness was just aging. She had accepted it. She had not known there was anything to address. Let me take you deeper into the serotonin mechanism, because understanding it changes everything about how you relate to food and mood. Serotonin is synthesized from tryptophan, an amino acid found in food. But the conversion of tryptophan into serotonin does not happen automatically. It requires specific bacterial enzymes produced by beneficial gut bacteria. When those bacteria are present in sufficient numbers and diversity, the conversion is efficient. When they are depleted, tryptophan is shunted down an alternative metabolic pathway toward a compound called kynurenine, which is associated with inflammation and has been linked in research to depression and cognitive decline. This means that the same dietary tryptophan that should become serotonin in a healthy gut instead becomes a pro-inflammatory compound in a disrupted one. The raw material is there, the factory is damaged, and the finished product, the mood-stabilizing neurotransmitter your brain is waiting for, never arrives in the quantity needed. There is also the vagus nerve dimension. The vagus nerve carries signals from the gut to the brain about the state of the intestinal environment, including signals about bacterial composition, inflammation levels, and the chemical output of gut cells. When the gut is healthy and the microbiome is diverse, these vagal signals are predominantly calming and regulatory. They tell the brain that the internal environment is stable. When the gut is inflamed or dysbiotic, meaning the bacterial balance is disrupted, vagal signals become erratic and pro-inflammatory, contributing to what researchers describe as a state of low-grade neuroinflammation that manifests in lived experience as irritability, low mood, cognitive fog, and reduced emotional resilience. This is not a fringe theory. This is peer-reviewed neuroscience from major research institutions across 3 continents. It is simply not yet part of the standard conversation that happens in a 15-minute appointment. Thomas was 67 years old, a former contractor. He came to me not for mood concerns. He would have resisted that framing entirely, but for what he described as a thinking problem. Words were slower to come. He lost his thread in conversations more often than he used to. He felt, he said, like he was always thinking through fog. His cognitive screening was normal. His neurologist had found nothing structural. His sleep was reasonable. His mood, when I asked directly, he described as fine. But his wife, sitting beside him, gave a small, significant look that told a different story. Thomas had taken a statin for 11 years, a PPI for 3, and had completed 4 antibiotic courses over the past 5 years for recurring skin infections. His diet was, by his own description, meat and potatoes. He ate almost no fiber, no fermented foods, and very few vegetables. We built a gut restoration protocol around his preferences, working with what he would actually eat rather than an ideal he would abandon in a week. Ground flaxseed in his morning oatmeal, a daily serving of yogurt with live cultures, gradually increasing vegetable variety, a targeted lactobacillus and bifidobacterium probiotic taken with his evening meal. At his 4-month follow-up, Thomas told me the fog had lifted, mostly. He was sharper in conversations. His wife confirmed it, with considerably more enthusiasm than Thomas himself would ever volunteer. He had not connected any of it to his gut. When I explained the mechanism, he sat quietly for a moment and then said, "I wish someone had told me that 40 years ago." I want to address 2 nutrients that sit at the intersection of gut health and mood in older adults, and that are frequently missed or undercorrected in routine care. Vitamin B12. The absorption of B12 from food depends on a protein produced in the stomach called intrinsic factor. As stomach acid production declines with age, intrinsic factor production also decreases. The result is that many older adults are consuming adequate dietary B12, but absorbing only a fraction of it. B12 deficiency develops slowly and insidiously, and its neurological and mood-related symptoms can be profound. Cognitive slowing, depression, irritability, fatigue, and a distinctive sensation many patients describe as a kind of emotional numbness. Critically, the standard B12 reference range used by most labs was established primarily using younger adult populations. A B12 level that falls in the so-called normal range may still be functionally insufficient for an older adult nervous system. If your B12 is below 500 picograms per milliliter, it is worth discussing with your physician whether supplementation or sublingual B12, which bypasses the stomach absorption pathway entirely, is appropriate. Folate, vitamin B9, works alongside B12 in a metabolic pathway called the methylation cycle, which is essential for the production of neurotransmitters, including serotonin and dopamine. Folate deficiency is independently associated with depression in older adults and is frequently overlooked because it does not generate the dramatic blood count changes that prompt investigation until the deficiency is severe. Leafy greens, legumes, and fortified whole grains are the primary dietary sources. Helen was 73, a retired bookkeeper. She had been prescribed a low-dose antidepressant 18 months before I saw her, not for clinical depression, but for what her previous physician had described as age-related mood changes. The medication had helped somewhat, but incompletely. She still had days she described as gray. She had gained weight. She was not sleeping as well as she had before starting the medication. Her B12 was 387 picograms per milliliter, technically within the normal range at her lab, but functionally suboptimal for someone her age with her symptom profile. Her folate was low normal. Her gut history included 2 years on a PPI, a diet low in fermented foods, and significant reductions in vegetable intake due to a dental issue that had made chewing uncomfortable for several months. We introduced sublingual B12, corrected her folate through diet and a methylfolate supplement, and built a gradual gut restoration protocol. We worked in close coordination with her prescribing physician. I want to be very clear about that. We did not alter her antidepressant independently. We addressed the nutritional and gut environment that the medication was trying to compensate for. At 6 months, Helen's physician, with Helen's full participation in the decision, began a slow taper of her medication. She described feeling more consistently like herself than she had in several years. The gray days had not disappeared entirely, but they were fewer and shallower. She had started a weekly book club. She had, she told me, things to look forward to again. Walter was 68 years old, a retired fire captain, the kind of man who had spent his career making decisions under pressure and who did not, by his own telling, do feelings particularly well. He came to me because his wife had issued what he described as a non-negotiable request. His chief complaints were irritability, short fuse, and what he called running out of patience faster than I used to. He slept well. He exercised. He did not drink excessively. There was no obvious trigger. He had simply, over the past 3 years, become harder to live with, and he knew it, even if naming it was uncomfortable. Walter's gut history was significant. Decades of non-steroidal anti-inflammatory drug use for joint pain. A diet built around convenience foods and almost no fermented or fiber-rich foods. Intermittent constipation he had normalized entirely. And a recent 6-week course of broad-spectrum antibiotics following a surgical procedure. The NSAID history was particularly relevant. Non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, and related medications, are widely understood to damage the gut lining directly. They inhibit the prostaglandins that protect the mucosal barrier of the intestine, creating a condition called intestinal permeability, more commonly referred to as leaky gut, in which the tight junctions between intestinal cells loosen, allowing bacterial fragments and inflammatory molecules to cross into the bloodstream. This triggers a systemic inflammatory response that, when chronic, contributes directly to neuroinflammation and mood dysregulation. Walter's protocol involved transitioning his pain management away from daily NSAIDs, working with his orthopedist on that specifically, repairing the gut lining with targeted nutritional support, including L-glutamine and zinc carnosine, and gradually rebuilding his microbial diversity through diet and probiotic supplementation. His wife called my office at the 3-month mark. She said, "I have my husband back." Walter, when I saw him, allowed himself a small smile and said nothing. But he did come back for his follow-up, which for Walter was the loudest endorsement he was capable of. Before we move to the protocol, an important note. If you are experiencing persistent low mood, significant changes in your emotional state, or symptoms that are affecting your daily functioning, please speak with your physician. What I am sharing today is educational guidance about the gut-brain connection. It is not a substitute for mental health care, and there are times when professional support, including medication, is exactly the right intervention. The gut-brain approach I am describing works best as a complement to that care, addressing the biological environment that underlies mood, not as a replacement for any treatment your doctor has recommended. Here is what I want you to hold on to from everything we have covered. The low mood, the fog, the shortened patience, the flatness that you may have been living with and attributing to age or circumstance. Some of that may be a message. Not from your mind about your life, but from your gut about its environment. Your gut has been changing for years, quietly, without announcement, shaped by medications, by dietary shifts, by the biological realities of aging, by antibiotic courses that seemed routine at the time. And those changes have been sending signals up the vagus nerve to your brain, signals about inflammation, about depleted neurotransmitters, about a system under stress. You were not imagining it, and it was not inevitable, and it is not permanent. The gut is one of the most responsive and regenerative systems in the human body. Given the right conditions, the right inputs, and a little time, it rebuilds. And when it does, the brain feels the difference. Step 1. Add 1 fermented food to your daily diet. Not a supplement, a food. Plain yogurt with live active cultures, kefir, sauerkraut, kimchi, miso, or kombucha. These foods deliver live, beneficial bacteria directly to the gut environment and have the most consistent research support for improving microbial diversity in older adults. Start with a small daily serving, a half cup of yogurt, or 2 tablespoons of sauerkraut, and build consistency before you build quantity. Step 2. Feed your existing gut bacteria with prebiotic fiber. Probiotic bacteria, the beneficial ones, cannot survive without food. Their food is prebiotic fiber, the indigestible plant compounds found in garlic, onions, leeks, asparagus, oats, slightly underripe bananas, and Jerusalem artichokes. You do not need to eat all of these. You need to eat some of them regularly. Aim for at least 1 prebiotic-rich food per day alongside your fermented food. These 2 steps together, probiotics and prebiotics, create the conditions the gut-brain axis depends on. Step 3. Discuss your medication list with your physician through a gut health lens. If you are on a proton pump inhibitor, ask whether your dose is the lowest effective one, or whether a step-down plan might be appropriate. If you have taken antibiotics recently, talk to your physician about a targeted probiotic course to support microbial recovery. If you use NSAIDs regularly for pain, ask whether alternatives, topical anti-inflammatories, acetaminophen, or physical therapy might reduce your gut lining exposure. This is not about refusing necessary medication. It is about minimizing unnecessary gut disruption. Step 4. Ask your doctor to check your B12 and folate levels. And if your B12 comes back in the low end of the normal range, Ask specifically whether supplementation is appropriate, given your age and symptom profile. Sublingual B12, a tablet that dissolves under the tongue and absorbs directly into the bloodstream, bypasses the stomach absorption pathway entirely and is highly effective in older adults with reduced intrinsic factor production. A methylfolate supplement, rather than standard folic acid, is better utilized by those with common genetic variations that affect folate metabolism. Step 5. Reduce ultra-processed food consumption, particularly in the evening. Ultra-processed foods, those high in refined carbohydrates, seed oils, artificial sweeteners, and emulsifiers, are among the most consistently documented disruptors of gut microbial diversity in the research literature. Emulsifiers, in particular, found in many packaged foods, have been shown to degrade the mucus layer that protects the gut lining and supports healthy bacterial colonies. Replacing even 2 or 3 ultra-processed food items per week with whole food alternatives creates a measurable shift in the gut environment over the course of 4 to 8 weeks. 90% of your serotonin is made in your gut. The nerve that connects your intestine to your brain carries more traffic than most people will ever be told about in a doctor's office. And the community of microorganisms living in your digestive system right now, the ones that produce your neurotransmitters, regulate your inflammation, and signal your emotional state to your brain every hour of the day. Those organisms are not fixed. They are not permanent. They are responsive to what you eat, to what you take, to the choices you make this week. You have more influence over how you feel than anyone may have given you credit for. And it starts, more than most people know, in the gut. I want to hear from you. Have you noticed a connection between how your digestion is doing and how your mood is doing? Or have you made any gut health changes that seem to affect your energy or your emotional state? Tell me in the comments below, because this is an area where personal experience is genuinely illuminating. And what you have noticed may be exactly what someone else needs to read. If someone in your life has been struggling with low mood, brain fog, or emotional flatness, and has been told it is simply part of aging, please share this video with them, because they deserve to know that there is a biological conversation happening between their gut and their brain, and that conversation can change. The next video picks up directly from here. We are going to talk about the 5 foods that older adults eat most often that are silently degrading the gut lining, including one that most people consider completely healthy. You will want to see that one. I will see you there.